Hello, good morning, good morning. It's Anna Goodwin Fernandez, the infectious doctor, and I am doing a quick, well, maybe not so quick, but hopefully quick update. I hope everybody's good. We're coming to the end of 1 week, and it's been a week. Some Donna this morning, she's like, "Oh, let us know your thoughts. Give us an update." So originally, I was going to just kind of mainly talk about what I kind of do, how I stay safe, and I will do that at the end. But I'll just kind of give a brief overview of my thoughts. And it still remain. I still think that this COVID-19 thing, it's actually pretty serious. Actually, it is. I always thought it was serious, but now as it encroached slowly on our area here in Mississippi. You're welcome, Carla. You're welcome. Good morning, everyone. Hey. So yeah, I used to look at the maps, Mississippi, Alabama, we're in way east Mississippi, and you just saw the case got increase every day, especially over the past week, dramatically. And so now in our area, Lauderdale County, East Mississippi, we have about 10 cases as of yesterday. And so, and I think also in some of the Caribbean islands, I'm from the Caribbean originally, Antigua, and basically everyone was just watching, and then now there are cases, like in my island, there's several cases as well. And they confirmed local transmission just this past couple of days. So it has reached home for almost all of us. And there was stress around all the time, but just this week, every day as the week went by, I kind of noticed more stress in, colleagues at work and so on. The nurses, I work with a lot of nurses. I probably hang around with nurses much more than doctors, because nurses are all around taking care of our patients. And the stress level slowly increased. And, it was definitely understandable because, we're taking care of our patients. Generally, most of our patients, of course, it's just the regular patients that we have to take care of with the regular medical conditions. But then you're worrying about, who could potentially, when you get new patients, kind of making sure you don't miss a potential case of coronavirus, because then, you don't want to put the rest of the staff at risk. And that's especially, the doctors when we get patients. And I was on call last week, and one of the big stresses was, okay, somebody has a cough, like, what do you do, right? And so that for me was one of the main stresses, just looking carefully at everything and just, asking all the questions and just making sure, that you try the best to make a decision. Okay, to isolate or not to isolate, and that's pretty stressful. And that was where my stress came in. And then for nursing, and then some nurses are more managerial and so on, and so they have to kind of control the flow of staff and make sure there's enough staff, and then you worry about your staff and the personal protective equipment. And it's no secret that there's like a shortage of PPE, personal protective equipment, I guess worldwide, certainly in America as well, United States. And so, you're just thinking, about all these risks, and what if you have a situation where maybe I don't know, like what if it runs out or whatever, and you still have your duties, and then your family is worried, your family at home. Like one nurse was saying that her mother-in-law was like, you don't need to be there, this coronavirus or whatever, COVID, like you don't need to be there. But the fact is, who is going to take care of sick people? We have the training to take care of ill people, and we have the training to apply or put on personal protective equipment in a proper way more than the regular population. And so somebody has to take care of people. If we weren't healthcare workers, if we weren't doctors, nurses, etc., and we were ill or thought we were ill and needed help, we would want somebody to take care of us as well. So now we're in this position, so we have to take care of people. So as much as our families feel like, oh, don't be a hero, don't be a hero and get this infection and, die or whatever. Like we have to take care of people, but at the same time, we have to be super, super cautious. And I mean, it's not like there's zero personal protective equipment, thankfully. So we still have personal protective equipment. And we have to generally minimize our stress so that we're not fumbling and making mistakes when we're putting these things on. And so all that requires a certain level of calm, as much as it might be a higher stress situation than normal. So you can see the stress level going up, but I, try my best, and I encourage, everyone as well. When I see people, you just encourage people to just, take a step back, take a breath, and we just kind of, pause and then continue to do what we are trained to do and what we know how to do. Okay. In terms of, I think we're probably, I'm almost tired of coronavirus already, and it's barely here already, but we know it's serious. I think one thing I would say is that the social distancing thing, it's very, very important, and we have to continue, to not go anywhere. Like I don't go anywhere. I just go to work and I come back home. My husband, he just, he goes to the supermarket, comes out. So we just go get things that are needed and come back. And I think more now more than ever, we all, like everywhere, worldwide, I guess, well, certainly in the United States, Caribbean Islands, Antigua, social distancing is really, really important, because that's how you're going to prevent ongoing spread or continued spread and rapid spread of this infection. And with rapid spread, you're going to go into a situation where there's just overwhelming of healthcare systems, because like so many people are going to get infected at the same time. And that's just, it's going to be too much for an already burdened system. So social distancing, don't go away. It's not going to kill you to not go, and hang out, So just like for once, maybe we could just kind of relax, do less, enjoy nature, maybe read a book or whatever, just do things in the house. But it's so important now more than ever, social distancing. Again, somebody mentioned social distancing at work, and I have to admit that I probably didn't think of it as much, and I was probably standing relatively close to people. Now, a few days ago, I was talking to this doctor, and on the same side of the counter, and then he stepped back closer to the wall, and I guess I thought he was getting out of the way, but I was thinking to myself, he was probably distancing, like getting to that 6 feet point, and yeah, it's social distancing at work is also important, because again, in the pre-symptomatic phase of infection, if somebody happens to be developing something, you have infection in the throat, in the back of the throat and so on. And if you happen to do a little cough or a little sneeze, the virus can go to the other person. And so you can have transmission at work as well. And of course, in healthcare system, we are high risk. We are at high risk for exposure. So social distancing, very important, as much as it might seem, social distancing, cool, social media, whatever, but social distancing or physical distancing, super important. And it's not gonna, be the end of the world if we don't get to hang out. But at the end of the day, if we can cut down the amount of new infections happening all at once, that would be a good thing. We can't forget to take care of ourselves, right? Part of just kind of being, strong and fit and well and more able to fight an infection is for us to remember to take ourselves. We have to try to sleep. Sleep is one of my deficiencies. I try as best as I can, but I know I could do better in terms of sleeping more. We have to eat well. Like you just have to eat proper food. You have to keep yourself nourished. And now is the time, maybe if we were all relaxed and kind of doing whatever we wanted to do, now is the time to pause and think, hey, you know what? Maybe there are things I can do to optimize my health and to decrease the chance of coming down with another illness. Because of this pandemic, care for other things might not be as accessible, or available as before. They've closed dentist offices, so you can't get your teeth fixed. Not unnecessary, but non-urgent screenings. Like, believe it or not, like I was trying to go and get a mammogram because I'm of age for a mammogram. And I said, you know what, let me just go and get a mammogram now. I'm not on call this week. And a couple of days ago, they actually stopped screening mammograms. So, there's other things that, you're not able to get right now. So what about somebody who maybe has pre-diabetes and they're not, they're still doing whatever, and then they end up with overt diabetes or some kind of diabetic emergency? You want to avoid other emergencies as much as possible, because the fact is, the healthcare system is overburdened because of coronavirus. Like, that's just a fact. And so if you can do things, eating properly, avoiding excesses and so on, that's going to be better for you in the long run. eating properly, getting exercise as well, just keeping the body fit, keeping your lungs good. I mean, if you have pneumonia, but you were fit and you had good lung capacity, you're better able to fight a bad pneumonia, like a pneumonia from coronavirus, than if you had not, very fit lungs. So now in terms of me and stress, I was asking yesterday, I mentioned, what are some things people do to avoid stress, or some of the phrases or whatever that come to mind to help you avoid stress. And for me, the one thing I keep coming back to is the statement from this book. It's always do your best. So this is a book, and it's going to probably look back to front because of the camera, but it's The 4 Agreements by Don Miguel Ruiz. And it's just kind of things to kind of help you have a more comfortable life. And one of the 4 that I always remember is always do your best. So always do your best. Basically, if you know you did your best, you cannot beat up yourself or chastise yourself because you absolutely did your best. Now, the thing is, your best is going to vary from day to day, from moment to moment. So my best would be better today, maybe, or could be better this morning because I'm well rested and nourished, etc., than it is this evening because I am more tired. My best could be better today than it is tomorrow, could be better this week than it is next week. But if like I'm doing my daily work and I'm trying to decide, look at the patients, look at everything, be obsessive compulsive in considering everything. And I say, okay, yes, I think, this patient needs to be in this unit versus that unit. Okay. So I did my absolute best. Right. And so if at the end of the day, there was some little thing, maybe they should have been there rather than there, I cannot beat up myself because I did my best. And you cannot do anything but your best. It's literally impossible to do anything but your best. You just can't, right? So if you know that you did your absolute best, then you just sit back. Okay, maybe this happened, that happened, or whatever, but you don't beat up yourself because you did your best. And that is how I remind myself. Like sometimes people ask me, how do you stay, happy, smiling, whatever, right? Because I try, I go out of my way not to be stressed and, worry and have anxiety or depression. They say anxiety is when you worry so much about the future, and depression is when you worry a lot about the past. Like maybe if you made mistakes in the past, and we all make mistakes, none of us are perfect. So when you worry so much about your past, then you get all depressed, or when you're so anxious about, my future, what's going to happen? Or, what tomorrow? How many admissions am I going to get? And so you get so much anxiety. But generally speaking, if you try to just kind of be as much in the moment as possible, right, then you just kind of deal with what you have to do step by step. I say, okay, I have this patient. I'm going to put all my attention to this patient now. Consider everything, definitely do my best. Like you can't just partially do it and kind of be half here, half there. Like you have to go out of the way to say, I'm going to dedicate all to this. I'm going to do my best here. And then at the end of the day, okay, this happened, that happened, but you literally know you did your best. And it's just in life in general. Like, for example, parents, people might judge and say, how you bring up your child, etc. Why your child is 3 and she's not potty trained yet. Like me, my son, he wasn't potty trained until he was almost 3. And, people would be looking, and I'm not saying about my son, but I've heard of cases where somebody's looking at a boy, like, why is he in diapers? Like, he's so big, why is he in diapers? And they're judging you because she's lazy. Why isn't she potty training her son? But if you know that you did your best, you have to go to work every day, and I guess to help support the family or whatever, you have to take care of other children, whatever, but you're doing your best, right? Given your circumstances. And so you should never feel bad about, he should be potty trained by now. You're doing your best. And so that is what, that should be your comfort, that you're doing your best. You shouldn't beat up yourself and be anxious and so on. I was telling a nurse one time as well, because, sometimes, again, you have responsibilities and it's like, so much, like I can't manage, So I said, look, you're doing your best, right? You just go there and you do your best. And, then whatever happens after, whoever wants to judge, they judge or whatever, but you absolutely do your best and just, let whoever take care of whatever, right? So that's this book. It's by Don Miguel Ruiz, really good book. The other agreements, it's the 4 agreements. Always do your best. That's my favorite. But he talks about as well, be impeccable with your word, right? He says, avoid using the word to speak against yourself or to gossip about others, okay? He says, use the power of your word in the direction of truth and love. The second agreement, do not take anything personally. And that's a big one. When we're doing our work, people might judge you. Oh, why did she do it like that? Why did he do it like that? And so these are some of the stresses. Why this, And so at the end of the day, you just have to be like, don't take anything personally, right? What others say and do is a projection of their own reality, their own dream. He says, when you are immune to the opinions and actions of others, you won't be the victim of needless suffering. And that's really, really true, okay? The third agreement, do not make assumptions. Communicate with others as clearly as you can to avoid misunderstandings, sadness, and drama, right? So this book is a small book. Some books are so big you don't have time to read them, but this is a nice small book, and I go back to it all the time. Sometimes we forget, I forget, stress out, whatever, but you go back to it. I go back to it. And as I said, always do your best. That's my favorite agreement. So that's what I'm saying to everybody now. Just do your best, protect yourself, take proper food, try to get a little exercise if possible, get some sleep. And just, for healthcare workers, we have to be vigilant, just like applying whatever protective equipment and so on. We just have to be so vigilant because we know that there are even people who are in good health who come down with serious cases of COVID-19. So get some rest, everybody, this week. Let's take a pause. And I know I was supposed to talk about what to do if you get exposed, and I'll do that another time, but I think we're all suffering from COVID-19 overload. Oh my goodness. So all I would say, get rest, keep away from people, and get good food and just kind of take care and optimize your health, and also, I guess, take care of your mind. Just keep positive thoughts, etc., so that you can, so that your overall well-being will be as good as possible. So I am going to end this, and thank you all for. Thanks for watching so early, and thanks for your time in paying attention to the posts that I make. And then, over the next, I'm going to do others regarding specific to coronavirus or COVID, but I just thought I would do something a little different today in terms of just overall well-being. So take care, everyone. Have some rest today. Have a good weekend. Bye.